Hello, I'm Dr. Mark, and welcome to Dr. Mark Official. With over 10 years of clinical experience, I share practical, evidence-based health advice. Today, we're talking about something many people love, ice cream. If you're managing blood sugar or living with type 2 diabetes, you may think ice cream is completely off limits. The good news is that's not always true. With smart choices and portion control, you can still enjoy a sweet treat. Let's start with the 5 best ice cream options that are generally more blood sugar friendly. Number 1, low carb or keto ice cream. Low carb or keto ice cream has become a popular option for people who want to enjoy a sweet treat without causing major spikes in blood sugar levels. These ice creams are specially formulated to contain significantly fewer carbohydrates than traditional varieties. Since carbohydrates have the greatest impact on blood glucose, reducing the total carb content can help support better blood sugar control. Instead of using regular sugar, which quickly raises glucose levels, low-carb or keto ice creams typically use sugar substitutes such as erythritol, stevia, monk fruit, or other low glycemic sweeteners. These alternatives provide sweetness with little to no effect on blood sugar when consumed in reasonable amounts. Another important feature of many low-carb or keto ice creams is their balanced macronutrient profile. They often contain higher amounts of fat and sometimes moderate protein, which can slow digestion and reduce the speed at which glucose enters the bloodstream. This slower absorption may help prevent sudden spikes and crashes in blood sugar levels. However, it is still essential to check the nutrition label carefully. Not all products labeled keto or low carb are the same. Some may contain hidden sugars, sugar alcohols that affect individuals differently, or higher calorie counts than expected. Portion control also remains important. Even though these ice creams are lower in carbohydrates, eating large servings can still contribute to excess calorie intake and potentially impact blood sugar. Choosing a reasonable portion and pairing it with a balanced meal plan can make low-carb or keto ice cream a more suitable dessert option for those managing type 2 diabetes or monitoring their blood sugar levels. Number 2, high-protein ice cream. High-protein ice cream is another option that may be more supportive for people who are managing blood sugar levels or living with type 2 diabetes. Unlike traditional ice cream, which is often high in sugar and low in protein, these varieties are formulated with added protein from sources such as milk protein concentrate, whey protein, or casein. Protein plays an important role in slowing digestion, which can help reduce the speed at which sugar enters the bloodstream. As a result, the rise in blood glucose levels may be more gradual and steady rather than sharp and sudden. When protein is included in a dessert, it can also promote a greater feeling of fullness. This may help reduce the likelihood of overeating or reaching for additional high-carbohydrate snacks later. Feeling satisfied with a smaller portion can be especially helpful for maintaining overall calorie balance, which is important for weight management and blood sugar control. Many high-protein ice creams also contain less added sugar than traditional varieties, making them a smarter choice when cravings strike. However, it is still important to read nutrition labels carefully. Some high-protein ice creams may contain added sugars or sugar alcohols that can affect people differently. Total carbohydrate content, serving size, and ingredient quality should always be considered. Even healthier options can impact blood sugar if consumed in large amounts. Including high-protein ice cream occasionally as part of a balanced meal plan can allow individuals to enjoy a satisfying dessert without significantly disrupting their blood glucose management. Moderation, awareness, and mindful portion sizes remain key factors in making this option work effectively within a healthy lifestyle. Number 3, no added sugar ice cream. No added sugar ice cream can be a more suitable dessert option for individuals who are monitoring their blood sugar levels or managing type 2 diabetes. As the name suggests, these products are made without added sugars such as cane sugar, corn syrup, or other sweeteners that typically raise blood glucose quickly. Instead, they often rely on natural sweetness from ingredients like milk, or use sugar substitutes such as stevia, monk fruit, or sugar alcohols to maintain flavor while reducing the overall sugar content. While the absence of added sugar is beneficial, it does not automatically mean the product is carbohydrate-free or blood sugar neutral. Milk naturally contains lactose, a type of sugar that still contributes to the total carbohydrate count. Additionally, some sugar substitutes, particularly certain sugar alcohols, can have a mild impact on blood glucose in some individuals. This is why carefully reading the nutrition label is essential. Paying attention to total carbohydrates per serving, not just the sugar content, provides a clearer picture of how the product may affect blood sugar levels. Portion control remains just as important with no added sugar ice cream as it does with any other dessert. Eating large amounts can still lead to increased carbohydrate intake and higher calorie consumption. Choosing a reasonable serving size and incorporating it into a balanced meal plan can help minimize potential blood sugar fluctuations. When selected thoughtfully, no added sugar ice cream can offer a satisfying way to enjoy a sweet treat without the same impact as traditional varieties. With mindful choices and awareness of ingredients, it can be part of a balanced approach to maintaining steady blood glucose levels. Number 4. Greek yogurt-based frozen desserts. Greek yogurt-based frozen desserts are often considered a smarter alternative to traditional ice cream, especially for individuals who are monitoring their blood sugar or managing type 2 diabetes. One of the main advantages of Greek yogurt is its higher protein content. Compared to regular ice cream, which is typically higher in sugar and fat, Greek yogurt-based options usually provide more protein per serving. Protein helps slow digestion and can lead to a more gradual release of glucose into the bloodstream, reducing the likelihood of sudden blood sugar spikes. In addition to being higher in protein, these frozen desserts often contain less fat than premium ice creams. Lower fat content can help reduce overall calorie intake, which is important for maintaining a healthy weight. Since weight management plays a key role in blood sugar control, choosing lighter dessert options can support long-term health goals. Greek yogurt also contains beneficial nutrients such as calcium and probiotics, which may contribute to digestive and overall health. However, it is still essential to read the nutrition label carefully. Some Greek yogurt-based frozen desserts may include added sugars or flavorings that increase the total carbohydrate content. Even though the base ingredient is healthier, sweeteners and mix-ins like cookie pieces or syrup swirls can significantly raise sugar levels. Checking the total carbohydrates and serving size helps ensure the dessert fits within a balanced eating plan. When enjoyed in moderation and chosen wisely, Greek yogurt-based frozen desserts can offer a creamy, satisfying treat with added nutritional benefits. Combined with portion control and mindful eating habits, they can be a practical option for satisfying sweet cravings while supporting stable blood glucose management. Number 5. Homemade banana nice cream. Homemade banana nice cream is a simple and natural alternative to traditional ice cream that can be especially appealing for those who want to manage their blood sugar more carefully. This dessert is made by blending ripe bananas that have been sliced and frozen until smooth and creamy. As the bananas blend, they develop a texture very similar to soft-serve ice cream, without the need for added sugar, heavy cream, or artificial ingredients. The natural sweetness of ripe bananas often provides enough flavor on its own, making it a satisfying option for those trying to reduce their intake of added sugars. Bananas do contain natural carbohydrates, so portion size is still important. However, because this dessert relies on whole fruit rather than refined sugar, it also provides fiber, vitamins, and minerals such as potassium and vitamin B6. The fiber in bananas can help slow digestion slightly, which may support a more gradual rise in blood glucose compared to traditional sugary ice cream. Pairing banana nice cream with a source of healthy fat or protein can further balance its effect on blood sugar. For example, adding a small spoonful of natural nut butter or a sprinkle of chia seeds can help slow carbohydrate absorption. Flavor variations are easy and customizable. Unsweetened cocoa powder can create a chocolate version without extra sugar, while cinnamon or vanilla extract can enhance sweetness naturally. A few berries can also add flavor and antioxidants. By preparing it at home, you have full control over the ingredients and portion sizes. When enjoyed mindfully, banana nice cream can be a wholesome and refreshing dessert that fits into a balanced eating plan. Now, let's look at the 3 worst ice creams to avoid if you're concerned about blood sugar. No. 1. Regular full sugar ice cream. Regular full sugar ice cream is one of the most challenging dessert choices for individuals who are trying to manage their blood sugar or live with type 2 diabetes. Traditional ice cream is typically made with significant amounts of added sugar, along with milk and cream. The added sugars, such as cane sugar or corn syrup, are quickly digested and absorbed into the bloodstream. This rapid absorption can cause sharp spikes in blood glucose levels, which may be difficult to manage and can lead to energy crashes afterward. In addition to its high sugar content, regular ice cream often contains refined carbohydrates that further contribute to increased blood glucose. When consumed in typical serving sizes, which are often larger than recommended, the total carbohydrate load can be quite high. Many people underestimate portion sizes, and what seems like a small bowl may actually contain multiple servings. This can significantly raise overall carbohydrate intake in one sitting. The combination of high sugar and high saturated fat in traditional ice cream can also impact overall health. Diets high in saturated fat may contribute to insulin resistance over time, making blood sugar control more difficult. Frequent consumption of full sugar ice cream can also add excess calories, potentially leading to weight gain, which is closely linked to blood sugar management challenges. While enjoying a small portion occasionally may be possible for some individuals, it requires careful planning and monitoring. Reading nutrition labels, measuring serving sizes, and understanding how the dessert fits into the day's total carbohydrate intake are important steps. For many people focused on maintaining steady blood glucose levels, choosing lower sugar alternatives is often a safer and more supportive option. Number 2, ice cream with candy, caramel, or syrup swirls. Ice cream that contains candy pieces, caramel ribbons, chocolate chips, cookie dough, or syrup swirls can be especially problematic for individuals who are trying to manage their blood sugar. While regular ice cream already contains a significant amount of sugar, these added mix-ins layer even more sugar and refined carbohydrates on top of an already sweet base. Each bite may contain concentrated pockets of syrup or candy, which can lead to even faster and higher spikes in blood glucose levels. Caramel and fudge swirls are often made primarily from sugar and corn syrup, both of which are quickly absorbed into the bloodstream. Similarly, candy pieces and cookie dough chunks typically contain refined flour and added sugars. These ingredients not only increase the total carbohydrate content, but also reduce the overall nutritional value of the dessert. What may look like a small addition can significantly raise the calorie and sugar count per serving. Another concern is that these mix-ins can make it harder to control portion sizes. The combination of sugar, fat, and flavor enhancers is designed to be highly appealing, which may encourage overeating. When servings become larger, the total carbohydrate load increases even more, making blood sugar management more difficult. For individuals with type 2 diabetes or insulin resistance, frequent consumption of these highly sweetened varieties can lead to repeated glucose spikes. Over time, this pattern may contribute to greater difficulty maintaining stable blood sugar levels. Choosing simpler options with fewer added ingredients, checking nutrition labels carefully, and practicing mindful portion control can help reduce these risks. Avoiding heavily mixed-in flavors is often a wise step toward better blood glucose management and overall health. Number 3, large portion premium ice creams. Large portion premium ice creams can be particularly challenging for people who are trying to manage their blood sugar levels. Premium varieties are often made with extra cream, egg yolks, and generous amounts of sugar to create a richer, smoother texture. While this may improve taste and mouthfeel, it also increases the overall calorie, fat, and sugar content per serving. The higher sugar content can lead to significant rises in blood glucose, especially when eaten in large quantities. One major issue with premium ice cream is portion size. The recommended serving listed on the nutrition label is often much smaller than what people typically serve themselves. A container may appear to be a single serving, but in reality, it may contain 2, 3, or even 4 servings. Eating directly from the container can make it easy to consume far more carbohydrates than intended. This excessive carbohydrate intake can result in sharp blood sugar spikes and make glucose levels harder to control for several hours afterward. Although fat can slow digestion slightly, the combination of high fat and high sugar in premium ice cream does not cancel out the impact on blood sugar. In fact, frequent consumption of high-fat, high-sugar foods may contribute to weight gain and increased insulin resistance over time. Both factors can make blood sugar management more difficult in the long term. Being mindful of serving sizes, using a measuring cup, and checking total carbohydrates per portion are important steps if choosing to enjoy premium ice cream occasionally. For many individuals focused on stable blood glucose control, selecting lighter alternatives or smaller portions is a more supportive and balanced choice. In conclusion, managing blood sugar doesn't mean giving up all your favorite foods. It means making informed choices. Always read nutrition labels, pay attention to serving sizes, and consider how a dessert fits into your overall meal plan. With balance and moderation, even ice cream can have a place in a healthy lifestyle. Thank you for watching Dr. Mark Official. I hope this guide helps you make smarter choices while managing blood sugar and type 2 diabetes. If you found this helpful, like, share, and subscribe for more practical, evidence-based health tips. Stay healthy and see you next time.